Chapter 11 in your CARS textbook will look at antifungals that are used to treat a variety of fungal pathogens. Some that are more systemic, some that are more superficial. So these just show some examples of the fungal infections that we might use antifungal medications to treat, things such as tinea pedis, tinea curus, tinea capitis, candida. Might be some examples, some of your nail infections as well. Some of your opportunistic fungal infections that can affect the lungs, we can use those antifungals as well. So how does a fungus differ from a bacteria? So a fungus has a rigid cell wall, um, and so the cell wall is made up kind of very differently from the bacteria. It has more protective layers, and so it makes a fungal cell um, more resistant to antibiotics. So patients that are more susceptible to fungal infections would include patients with AIDS or AIDS related complex, patients who are taking immunosuppressant medications, patients who have undergone transplant surgery or cancer treatment like chemotherapy, and members of the growing elderly population no longer protected from environmental fungi. So before a antifungal agent is prescribed, just like with our anti-infectives in general and the antibacterials that we talked about, as well as antivirals, a culture needs to be obtained. A patient on antifungal agents are typically immunosuppressed, and so they should not be placed at additional risk for, having the wrong medication prescribed and at risk for, more toxic effects to them because they're already immunosuppressed. Most common systemic antifungal agents that are used is caspofungin, which is for invasive aspergillus gillosis, which is a fungal lung infection. Uh, Fluticasone, which can be used for systemic infections caused by Candida or Cryptococcus, and nystatin, which is an oral used for intestinal candidas, and it's also available in several topical preparations as well. Use of antifungals across the lifespan. You have a box in your CARS book that talks about, again, children, adults, and older adults. And again, a couple of the things mentioned here would be, for example, it mentions your topical agents should not be used over open or draining areas where we don't want those to be systemically absorbed. In adults, these drugs can be toxic, so we do need to be very careful that we're using them with the appropriate kinds of fungal infections and that we're using them appropriately. In our older adults, we are concerned about hepatic issues and renal toxicity, and that we're doing a lot of monitoring of those patients. Um, all right, so this kind of shows site of action of antifungal. So you're seeing, how topical antifungals, systemic antifungals, it's going to affect how those fungus how that cell wall is able to be broken down. Um, okay, so the classification of drugs that we're going to kind of look at here, you have the azoles um, that are used to treat the systemic fungal infections. They're less toxic than amphotericin B, but they are also a little bit less effective. Absorbed rapidly from the GI tract, metabolized in the liver, and excreted in urine and feces. They are contraindicated in hepatic and renal dysfunction, um, pregnancy, and in lactation, and any drugs that prolong the QT interval in your patient, and that would show up on an EKG. Your azoles do cause liver toxicity and teratogenic effects. And your textbook will list many drug-drug interactions with your azole medications. Ecocandin antifungals, you have another group here. And they inhibit glucan synthesis and causes death of that fungal cell wall. They are given IV, so they have a rapid onset, metabolized, degraded, and excreted through the feces. Contraindicated with hepatic and renal dysfunction, pregnancy, and lactation. And they also cause liver toxicity, teratogenic effects, as well as bone marrow suppression. And there's a drug-drug interaction with these antifungals with cyclosporine. Here you do have caspofungin as an antiviral as part of the ecocandins class. And so it's going to act on the cell wall of the fungus. And we do need to be aware that many of these medications are going to cause adverse effects. So we need to continue to assess our patient throughout the therapy and see if there are secondary infections that are produced because we're treating a fungal infection. Then there might be secondary, like bacterial infections or secondary fungal infections that pop up as well as assessing for GI effects or any other effects that these medications would have on the body. So here's a question, true or false? Nystatin taken orally is used for the treatment of intestinal candida. And yes, that is true. Nystatin is used for intestinal candida as well as a topical preparation. Amphotericin B is another antifungal. It is very potent, and it's reserved for the progressive, potentially fatal fungal infections. It is used in the IV form only and excreted through the urine. It's contraindicated in pregnancy, lactation, and renal impairment. And adverse effects are related to the toxic effects to the liver and the kidneys. You could see severe renal impairment and bone marrow suppression. Drug-drug interactions, so amphotericin B in any nephrotoxic antibiotics or antineoplastic, cyclosporin, or corticosteroids. We also should be aware that amphotericin B will affect some of the lab values and increase lab values such as BUN, ALT, and AST, and possibly decrease values for things like sodium and calcium. And so some of the things that we would be concerned about is taking a look at that BUN. If it rises or exceeds above 40, then typically we're not going to give amphotericin B at that time if it has affected the BUN that much. Also, amphotericin B is nephrotoxic, but it can also be ototoxic, similar uh, in a side effect to aminoglycosides. Uh, Fluoxetine prevents fungal cells from reproducing by altering the cell membrane. Um, in IV form only. That's not true. Your topical antifungal agents work to alter the cell permeability, so they're really only good for local treatment um, of infections, particularly tinea infections. They are not used systemically, contraindicated with known allergies to these medications. Adverse reactions are typically localized, like local irritation, burning, rash, or swelling. And we're not aware of drug-drug interactions with your topical antifungals. So here's a question. Which of the following is considered a contraindication of ketoconazole? So it's one of the azoles. Patients with renal problems, patient with fertility problems, patients with hepatic problems, or patients with GI problems. So let's look at the answer. And the answer to the question is patients with fertility problems. It is not the drug of choice for patients with endocrine or fertility problems. So nursing considerations for systemic antifungal agents. We want to know their allergy history, their current physical status. A culture should have been done from the infected area, and liver and hepatic function tests and CBC should be done. So BUN, creatinine, looking at liver function tests, and liver enzymes like AST and ALT, and a complete blood count. Nursing considerations for topical antifungal agents are similar. We want to know about allergies, patient's physical status as a baseline, culture and sensitivity testing, as well as the area of application. We want a baseline for the color, the temperature, and the lesions that are present so that we can compare those after application and after the patient has been undergoing treatment. Prototype antifungal agent is fluconazole, is one. For the treatment of oral pharyngeal, esophageal, and vaginal candida, cryptococcal meningitis, systemic fungal infections, and prophylaxis to decrease candida in patients who have bone marrow transplants. It can be given oral or IV, and we see mainly GI adverse effects with that one. Another prototype is clotrimazole, which is for oropharyngeal candida, as well as it's used in vaginal preparations, also topical for tinea pedis, tinea curiis, and corporis. Uh, and you can see the vaginal preparations could cause irritation or burning with urination and increase in frequency. So the nurse is caring for a patient with a fungal infection Which of the following would be considered an adverse effect of an antifungal medication? Burning or irritation in the sexual partner, abnormal kidney function tests, upper abdominal pain, or urinary retention? And the answer is burning or irritation in the sexual partner. So when um, your antifungal is used in like a vaginal preparation, it can cause burning and irritation. Amphotericin B, just to kind of revisit that again, is used for severe infections that don't respond to others. It's IV for systemic effects and PO for local GI effects, but typically it would be an IV preparation, but it could be either. Adverse uh, effects of amphotericin include infusion reactions, nephrotoxicity, renal problems, blood dyscrasias, injection site reactions, GI disturbances, and there could be other known adverse effects. Like we do know it to also be ototoxic, and it can be given intrathecal, possibly topical, but typically this is an IV preparation. So nursing implications in patient education. So when we're looking at, say, amphotericin B, for example, some of the things that we would want to make sure is to teach the patient, about the treatment, what signs and symptoms to report, and to make sure that we're assessing the patient and monitoring them frequently, and watching their lab work, looking for allergic reactions, making sure that they are remaining hydrated if they're on oral or IV antifungals because of the renal toxicity. So they should be increasing their fluid intake to at least 2 liters per day, if at all possible. We're also going to monitor for signs of ototoxicity, as well as hepatic toxicity. So, making sure the client knows to report things like jaundice, yellowing of the sclera, light or clay colored stools, or darkening of the urine. We're also going to look at the IV site frequently because your IV antifungals can cause extravasation or thrombophlebitis. If possible, we would prefer to use a central line instead of a peripheral IV, to try to minimize some of the problems, like with the irritation to the veins. For patients who are taking ketoconazole, we might need to monitor blood glucose as well. And then watching for GI effects and making sure that they know to report that. So nystatin is used for candida orally or topically, and it's poorly absorbed in the GI tract. Fluconazole, so your diflucan, is candida prophylaxis in immunocompromised patients, and it can be an alternative for systemic mycosis. And so, its adverse effects, things like headache, stomach pain, and vomiting and diarrhea. And again, nursing implications, really for all of these, we want our patients to be aware of the medication, to report any signs and symptoms of allergies or problems that they might be having. Since it is an antifungal, we want to make sure that they're taking plenty of fluids, and letting patients know that They might have some changes to their lab values, like their liver function tests, um, and that there might be some interactions with other medications that they could be taking that might, interfere with uh, their ability to be able to either take these medications, or that it might uh, not might increase their risk for other issues. You also have polymyxins or peptides, and these can be used with meningitis and urinary tract infections. You also have medications like bacitracin, I think, that are listed in this chapter as well, which we think of those as being antibiotic, first stage